The spleen is a vital organ located in the upper left part of the abdomen. It plays several important roles in the body, including filtering blood, recycling iron, and helping the immune system fight infections. Problems with the spleen can arise from various causes, and in some cases, removal of the spleen splenectomy may be necessary. Here's an overview of spleen problems, the reasons for spleen removal, the procedure, and potential complications. Common spleen problems: splenomegaly, enlarged spleen. Causes: conditions such as infections e.g., mononucleosis, malaria, liver diseases e.g., cirrhosis, blood disorders e.g., leukemia, lymphoma, and inflammatory diseases can lead to splenomegaly. Symptoms: often asymptomatic but can cause discomfort or pain in the left upper abdomen, fullness after eating small amounts, and anemia. Hypersplenism. Description: the condition where the spleen is overactive, leading to excessive destruction of blood cells, red blood cells, white blood cells, and platelets. Symptoms: this can result in anemia, leukopenia, low white blood cell count, and thrombocytopenia, low platelet count, leading to increased risk of infections and bleeding. Spleen rupture. Causes: trauma e.g., from accidents, sports injuries, or diseases that weaken the spleen e.g., infectious mononucleosis. Symptoms: sudden severe abdominal pain, lightheadedness, and signs of internal bleeding such as rapid heartbeat and low blood pressure can occur. Spleen tumors. Types: can be benign non-cancerous or malignant cancerous. Lymphomas can involve the spleen, as can primary splenic tumors. Symptoms: often asymptomatic but may cause abdominal pain, unexplained weight loss, or other systemic symptoms. Infections. Common infections. Certain infections can affect the spleen, leading to conditions like splenic abscesses, which may arise from bacterial infections or as a complication of endocarditis. Reasons for spleen removal: splenectomy. Splenectomy may be indicated for various conditions, including severe trauma. In cases of ruptured spleen where there is significant internal bleeding, splenectomy may be necessary to save the patient's life. Certain blood disorders. Conditions like idiopathic thrombocytopenic purpuritis or hereditary spherocytosis may benefit from splenectomy to reduce the destruction of blood cells. Splenic tumors. If a tumor is present in the spleen, removal may be necessary to treat cancer or to manage benign growths that cause symptoms. Hypersplenism. If the spleen is overly active and causing significant blood cell destruction, removal may help manage the condition. Infections. In cases of persistent or severe infection localized to the spleen, splenectomy might be necessary. The splenectomy procedure. Splenectomy can be performed through various surgical approaches. Open splenectomy. The larger incision is made in the abdomen to remove the spleen. This method may be used in emergencies or when significant complications are anticipated. Laparoscopic splenectomy. The minimally invasive technique that involves small incisions and the use of a camera and specialized instruments. It typically results in less pain and faster recovery. Recovery and complications. Recovery. Most patients stay in the hospital for 1 to 3 days after surgery, depending on the procedure's complexity and the individual's overall health. Full recovery can take several weeks. Potential complications. Bleeding. As with any surgery, there is a risk of bleeding during or after the procedure. Infection. Patients may have an increased risk of infections post-splenectomy because the spleen plays a role in filtering bacteria from the bloodstream. Vaccinations. It is important for patients to receive certain vaccinations before and after splenectomy to reduce the risk of infections, particularly from encapsulated organisms like pneumococcus, meningococcus, and Haemophilus influenza type B HIV. Blood clots. There may be an increased risk of thromboembolic events, blood clots, post-surgery. Post-splenectomy care. Vaccination. Patients are usually advised to receive vaccines against pneumonia, meningitis, and influenza before the procedure or shortly afterward. Regular check UPS. Ongoing follow-up with a healthcare provider is crucial to monitor for potential complications. Awareness of symptoms. Patients should be vigilant about symptoms of infection and seek medical attention promptly if they develop fever, chills, or other signs of illness. Conclusion: spleen problems can range from benign to serious, requiring careful evaluation and treatment. Splenectomy is a common surgical intervention for various spleen-related conditions. While the removal of the spleen can have implications for the immune system and infection risk, appropriate medical management and vaccination can help mitigate these risks. If you suspect any issues related to your spleen, it's important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment options.